The idea of memory clinics has actually been around for decades. So the first ones started or appeared in sort of scientific literature in and around the late 70s, early 80s. And a memory clinic is simply a facility where there are healthcare practitioners from many disciplines all working under one roof and focusing on memory and cognition problems. So in Europe, they have a longer history of memory clinics, although not that much longer, also back about the 60s. The idea being there's a recognition that aging populations can mean by definition a greater incidence of dementia, and what is the best way to provide care for these places, for these people in these places. So Canada, first memory clinic in and around the 80s, but the idea of providing service to people with dementia through a memory care clinic is growing and expanding. So meaning more and more family doctors are creating memory clinics within their practice. Most of them, that's not a full-time practice. So it could be half a day or 2 days a week where they offer 4 hours for their patients to come in and learn about, talk about, deal with those problems related to memory and cognition. And then there's other models of memory care clinics that are hospital-based. So they are one arm of the specialty in much the same way that you would have a maternity ward or something. You can go to the memory clinic within a hospital where they have neurologists and social workers and gerontologists all focused on one discipline and one specialty to help you. And then standalone practices that are devoted only to that. You would get a referral from your primary care physician and they would send you to a memory clinic. That's not the place where you go for your annual checkups. That's not the place where you go if you suspect that you have a cold. It's the place where you have probably 2 to 4 appointments per year, and all you talk about are those circumstances, conditions, symptoms that are related to your memory. Yeah, I asked a couple of the doctors that I spoke to, and they all had different theories about why we might not know that there are memory clinics, and that ideally a memory clinic should be your first stop when you have not just a diagnosis but a suspicion of memory problems. So one of the doctors I spoke to thought that part of it is a sense from family care practitioners, your GP, that memory clinics aren't needed, that they are, we're introducing another level of specialists and therefore another level of cost and another level of bureaucracy into the healthcare system. And so that family doctors can handle and help their patients understand what they're going through. And when you add the organizations that exist out there, like the Alzheimer's societies, there is a belief, this doctor suspected within primary care health providers, that memory clinics aren't necessary. But the point that she made that I found most interesting is that people think the waiting lists are really, really long. And they're not short, but her clinic, for example, it's a 2-month waiting list. So oftentimes if you go to your doctor, you have brought your mother in to see her doctor and you think that her cognition is on decline, your family doctor might think, my God, I don't have 6 months or a year to wait to get you to the next step. Here, I'm going to deal with it instead. Here's some pamphlets I have, go to the Alzheimer's Society, maybe let's try and get you an MRI, in a more fragmented approach, because they've assumed that the help through a memory clinic will take too long. It's not true. Some memory clinics do indeed have wait lists of 2 years. One of the first ones in Canada is in Quebec, and it is very highly regarded and sees, I think, 800 patients a year, but the waiting list is close to two years. But then there are other places, like I said, where 2 months, or within some of the large general hospitals here in Toronto, 3 to 5 months. And if there is an emergency situation, you will be bumped to the top of the list. So awareness, not awareness of people on the street, but like awareness other doctors' lack of awareness of this specialized care that existed. And I thought that was very disappointing, but really interesting. And for her, one of the messages to get out was the wait lists are not that long. Call. The onus is definitely on the consumer, and in this case, I mean the patient, to find their information rather than some overseeing agency making sure that all the information goes first to the doctors and then down to the patients. It really is the other way. It sort of starts with the responsibility of patients to find out what's available for them. I think that's upside down. I do think that's backwards, but that's the reality of the healthcare system that we have. And if people know that, they have to be on top of the research, that they now have almost like a part-time job if they have a diagnosis of dementia within their family, that they need to, advocate is kind of an airy-fairy word. It's non-specific, but you need to be reading about this. You need to be researching it. It's as simple as devoting a part of your day every day to monitoring what's out there on the subject of dementia and our healthcare system. Nobody wants to have this diagnosis or have this in their family. Nobody wants dementia in their family. But I had, when I left that afternoon, that clinic, the sense of, if this ever happens to me or anyone in my family, this is my first stop. I had that experience where I was like, and we don't all get that, right? Where I was able to say, everything here made me feel comfortable, and like you have access to things that I couldn't have imagined. For example, clinical trials, which are a very big part of being able to get full treatment. We know there is no cure for Alzheimer's, but we know that we can manage symptoms, that there are various ways that people can choose or not to improve the quality of their lives, whether that's through sometimes prescription drugs help, and sometimes they do not, there's other therapies, but clinical trials give you access to drugs that have not made it to the market yet. They give you access to treatment and therapies that at a certain point in your experience with dementia, you might want to try. And to me, this was mind-blowing in the sense that once I get into your doors and I am now one of your charges, you will let me know if there's an appropriate clinical trial here in this facility, because often they're right there, or if there is one down the road, as they say, or somewhere else in the city, then they can make those arrangements for you to be part of that clinical trial. And for those Canadians who can or want to, memory clinics can also make that connection with American facilities that you might be interested in exploring, or clinical trials that you might want to be part of, or another type of testing that you might want to do that's only available through the private system and out of the country. But clinical trials to me were like, they're just so vital, and not something that I read about or heard about anywhere else except through memory clinics. Some of them don't offer the clinical trials right there, but they are the place that they can tell you what clinical trials are happening in your country, in your province, in your city, and get you in if it's appropriate. Dr. Cohen, is it sort of unfair that maybe I kind of developed a little reporter crush on Dr. Cohen? Because we got to talk about personal stuff too. She has Alzheimer's in her family fairly extensively, but she was very quick to say that's not why she became a neurologist. And in fact, she's always had an interest in the human brain and the way that it works and what makes us tick. And she was open about saying, even when I was a kid, when my pets died, I would want to dissect them and I wanted to get in there. She's fascinating. That might sound horrible. I'm telling you that it's not. That there was this woman who, even as an 8 and 9-year-old, knew that at the center of us, in our heads, is actually something she wanted to help people with and get in there about. A kind of Dr. Cohen and her husband, who both run the Toronto Memory Program, seem to have a level of curiosity and commitment and devotion to their patients and to the idea of helping dementia that's kind of contagious. It took 6 months to renovate her facilities to do what she wanted to do. And what she wanted to do was to have a space for patients and caregivers to go so that they both felt comfortable. If you have to have your blood work taken, I don't want you to have to walk too far down a hallway. How do we make this hallway as short as possible? But if you as the caregiver want to learn about meditation techniques, which are going to be probably vital to you if you spend any extended time as a caregiver, come into this other room on the side with the upholstered chairs and a podium, and we will bring in the expert guest speakers to help you learn about the techniques that will help you cope, the products that will help you cope. Like, there are a lot of safety alert products that caregivers need to know about, alarm systems that can be attached to the bed, alarm systems that can go off if the stove is left unattended and on, mechanisms that can attach to your medication dispenser that make it so that your charge can still be in control of taking their own medication, but if a day gets missed, an alarm goes off. If a dose gets missed, and that's a big deal for people as they're going through the progression of dementia, the things that they are forgetting to do or unable to do for themselves, or what causes the most problem for them. If you're on heart medication or you're on insulin, or there's other things that you need to be taking and you've forgotten to do that, but there's products out there. They're not always for free, but there's products, but you need to learn how to use them, where to access them, how to introduce your mom to the fact that she may have to start using them. And so you can do that from Dr. Cohen's facility. And she like sort of opened her arms to hug the whole family. And I kind of was inspired by her. The people who I interviewed who were not professionals, but rather were the caregivers of people who had dementia, talked about the stigma of the diagnosis. And I think that that's why for the people that I spoke to, and it makes sense it would be for so many, it takes so long to actually go and pursue the diagnosis. I don't know how many people I spoke to who said, you know, for years my husband had been working full-time, active and engaged in his community. He did our family finances. He may have, you know, been responsible for the upkeep of the house. Remember, I'm speaking to women who are in their 70s and 80s, so there's a very traditional way of dividing domestic chores. But he would forget things. So he would forget familiar names. He would not remember things that his personality previously he never forgot. And those things embarrassed him. And he didn't want to tell other people, even our children, this often came up, didn't want to tell our children that he was struggling with these things. So we would dismiss them as blips. Oh, he forgot the neighbor's name. Oh, he forgot to pay this bill. They're becoming more frequent. And I think that is about a kind of internalized shame that is so sad, right? And obviously the people around him, him being these many husbands, would not have in any way judged him, but there was a lack of power, a lack of authority, a sort of decline that was difficult to accept, and he could no longer, they couldn't take care of themselves and their families the way they had previously, and so it stopped them from finding out what was wrong. And you know, maybe by delaying that, stopped them from being able to control the symptoms too. And a lot of the caregivers that I spoke to recognized that, or at least believe that if they had perhaps been able to get to the doctor sooner, perhaps had been able to get a diagnosis earlier, there would have been more options for managing the symptoms. But it was the most common story. Embarrassment and delayed investigation.